Post-Polio Syndrome is a condition that affects people who survived poliomyelitis, usually decades after their initial infection. Thanks to global vaccination efforts, polio has been mostly eradicated. But for those who lived through the epidemics of the 1940s and 1950s, a new challenge has emerged much later in life. Many of these survivors, now older adults, are reporting new symptoms: muscle weakness, fatigue, and musculoskeletal pain. These symptoms fall under what we now recognize as post-polio syndrome, or PPS. This condition usually appears at least 15 years after the initial polio infection. It's not a small issue. Globally, it affects an estimated 15 to 20 million people, and it doesn't discriminate. Men and women are equally affected. So what causes it? The truth is, we don't know exactly, but researchers believe it has to do with the body's attempt to compensate after the original viral damage. When polio first hits, it destroys some of the neurons that control muscles. The ones that survive often sprout new branches to reinnervate muscles and restore function. That's part of why many people recovered, at least partially, from the initial infection. But over time, especially with age or overuse, those extra sprouts may start to wear out. The muscles that were holding on start losing their strength again. Diagnosing PPS isn't straightforward. There's no lab test or imaging scan that confirms it. It's a clinical diagnosis, based mostly on history and physical exam. The pattern providers look for is someone who had paralytic polio, then recovered function, at least somewhat, and then, years later, begins experiencing new weakness, fatigue, and pain. That plateau period, followed by recurrence, is key. Other possible causes of the symptoms must be ruled out first, because there's no single test that can say, yes, this is definitely PPS. Treatment is another challenge. There's no cure, no magic medication, and no specific surgical fix. This is where nursing care becomes essential, not just helpful, but truly central to the patient's quality of life. The focus is on symptom management and helping the person maintain as much function and independence as possible. Interestingly, some studies have shown that intravenous immunoglobulin infusions may help with pain and weakness, though results vary. Beyond that, it's about working with the patient and the care team to build a plan that addresses their physical, emotional, and social needs. Nurses can help patients with energy conservation strategies, planning out the day so that important tasks are done in the morning when energy is highest, and incorporating regular rest breaks to avoid exhaustion. Assistive devices should be encouraged as tools to preserve function, not as signs of defeat. Pain is often a problem, especially in joints and muscles, and because many of these patients are older adults, non-pharmacologic options like heat and cold therapy are often safer than adding more medications. Polypharmacy is already a concern, so less is more when possible. Nutrition can be tricky. These patients are often less active due to fatigue and weakness, so the balance between getting enough nutrients without gaining excess weight becomes a daily struggle. Obesity can add to joint stress and worsen mobility, so dietary support is important. On top of that, pulmonary hygiene and fluid intake can help with airway management, particularly in patients with reduced respiratory muscle function. Sleep is another area to assess. Some patients may have difficulty sleeping due to discomfort, nocturia, or even undiagnosed sleep apnea. Cutting back on caffeine, managing fluid intake before bed, and screening for obstructive sleep issues are all key parts of the plan. In some cases, CPAP or other supportive ventilation may be needed. Bone health is another concern. Many patients with PPS have been found to have low bone mass or even osteoporosis. That raises the risk of fractures, especially with fatigue-related falls. So fall prevention and bone density screening are essential. Interventions might include calcium and vitamin D supplementation, weight-bearing exercises if tolerated, and home safety assessments. But there's more to this than physical care. Relationships within families can shift when one person becomes more dependent. Nurses play a key role in helping families navigate these changes and in encouraging conversations around expectations, boundaries, and support. Social workers, physical therapists, occupational and respiratory therapists, chaplains, everyone has a role in this patient's care team. Finally, we can't forget about prevention and health promotion. Just because someone has PPS doesn't mean we stop doing the basics. encourage routine screenings, vaccinations, dental visits, and age-appropriate wellness checks. The goal is to keep them healthy and independent as long as possible. In summary, post-polio syndrome is a slow-onset condition that brings new challenges to those who thought they'd already survived the worst of polio. There's no cure, but there's plenty we can do. With thoughtful nursing care, energy conservation, pain management, nutrition, respiratory support, and fall prevention, we can make a big impact on both daily function and overall quality of life.